Okay, so we only have an hour and we might hear more folks joining, but maybe just to kick us off, we are super excited to be kind of hosting this webinar on exploring system mapping in a real world context. We have Paz here with us from Reimagine Futures. And I think, Paz, the intent is to make this an interactive session, right? So you'll share with us some of the information and then ask us to engage with you on some of the learnings that you've done on using system mapping and applying it to tackle some real complex challenges out there. So thank you for your time, for this knowledge, and I look forward to our participation today.
Well, thank you, Anne-Marie. Thank you for inviting me and for being here, everyone. Well, I'm from Reimagine Futures. I'm actually an environmental scientist working for a year and a half almost now at Reimagine Futures. Reimagine Futures is a small systems change consultancy. We help organizations understand complex systems and try to address or tackle different challenges through systems thinking. Our star product are systems maps, so that's why I'm here. And first, I would like to start by asking you to raise your hands, or virtual hands, those who don't have their cameras on, who has seen a systems map before? Yeah. Well, I think all of you, or almost all of you, I'm glad. So maybe I won't stop too much on trying to explain a systems map, but maybe we can allocate some more time to the systems map itself. So let me share my screen. I prepared some slides for you. So, well, I will go quickly through this, but a systems map is this beautiful visual, which represents a qualitative causal loop diagram. Sorry, I'm trying to. Do you all see my screen there, right?
Yes.
Okay. So this is a systems map, which is a causal loop diagram that visualizes the main dynamics of a complex system, in this case, the health or the approach to health of a Catalan system. And it's actually trying to gain clarity about the complex behaviors of the system itself. And beyond this just analysis of the entrenched dynamics, this diagram also serves as a storytelling tool, as a collaborative, cohesive storytelling, because each feedback loops brings an individual story of the system, which would all combine form the overall story of the system. And this shared understanding also creates an opportunity for stakeholders to be on the same page of a system and to recognize their roles in the system too. And these systems maps are usually used to identify afterwards different leverage points to create systems change towards a guiding star or a shared long-term vision. I forgot to say this, but please stop me if you want to ask questions as we go. So this is more entertaining for everyone, because maybe I won't be able to read the chat. So don't mind to interrupt as we go. The systems mapping that Reimagine Futures offer is a service that is designed to help these organizations and networks, depending on the client, to think more systemically and to foster inclusive conversations with different stakeholders, and especially to discover, identify those invisible dynamics behind the behavior of the systems. And as we like to say, the systems mapping is basically putting systems thinking into practice. So this is a very powerful tool to bring together different stakeholders, diverse voices, and conversate about the complex dynamics that drive a system to behave the way it behaves. Then we have three different purposes that our systems maps try to achieve. One of them is we use systems map for systemic investing. For example, this systems map in investing in food. The purpose is to reveal the key dynamics of a complex system and its unintended consequences. In this case, what are the unintended consequences of the food system, of the global food system, and identifying leverage points for systemic investing. Then we have systems map that serve the purpose of decision making. In this case, the early childhood development in emergencies map is still being used by the Moving Minds Alliance to guide their strategy process and their decision making. And last but not least, the case that we all want to hear today, the transitions towards a holistic approach to health, which is part of the development of a framework, a new policy framework that GenCat, and I'm going to say GenCat, which is the government of Catalonia, but it's how we abbreviate Generalitat de Catalunya. And the Catalan government is developing this policy framework called Share Agendas, and the purpose is to create capacity building. So they bring up different stakeholders to talk about different systems, in this case health, but we also created one about, for example, rural depopulation, and develop these shared agendas. So next, this is briefly, I will introduce you to what are the inputs for the system, because Reimagine Futures, we are not the content creators of the systems map. We are just the facilitators. We are experts in systems mapping, in systems thinking. But the content of the map is brought by, depending on the client, it's more or less of each one of these. But in the case of GenCat, for example, the core team input was very, very important. We co-created the map throughout like 8 months of process with 3-5 people. And we ensure the alignment and the co-creation of the system map as we went. But they also recommended us to read certain reports and documents, not only from the government of Catalonia, but also academic papers on the holistic approach to health, for example. And of course, interviews and workshops are also very important for our systems map, because it's what brings other voices, other stakeholders into the systems mapping process. In the case of this map in particular, we interviewed nearly, I think 8 different specialists in the field. So I will tell you about a feedback loop in particular that we brought from these interviews. Okay, so how we build a systems map. I know that maybe most of you have seen a system map before, but maybe you weren't part of a system process. Let me see you a little bit more. But does anybody of you participated in a systems mapping process before? No. Okay, this is interesting. So basically, we base our methodology on the Omidyar group systems practice methodology, which is free and it is online. You can all see it. But basically, the process is to first and most importantly define a guiding star. The guiding star is a vision, the long-term vision of what we want to achieve. And this guiding star often is translated into a framing question, which is the one that guides the systems map process. And of course, we also define the boundaries of the map, because a system is infinite. We can continue working on the systems map forever. So it is very important to mention also that a systems map is still a model of the reality. Once we define the guiding star, the framing question, and the boundaries, we start researching and we start the process with the core team, and we identify the different enablers and inhibitors of the guiding star and analyze their upstream causes and the downstream effects. Because with those upstream causes and downstream effects, we create feedback loops, which are the building block of the systems map. Once we create the feedback loops, we share them and we co-create them together with the core team, and we identify the deep structure of the system. The deep structure are those main dynamics that answer the framing question directly in a very broad way. Now we're going to see the case of the health system of Catalonia. Then we create the first draft of the systems map. We usually hold workshops with different stakeholders to validate that structure of the map, and with the core team, of course. And then we implement that feedback and comments and suggestions. And sometimes it takes further research or further interviews, and we come up with a final presentation of the map. This is the methodology, broadly speaking. Then, how do we read the map? As I told you, the feedback loop is the building blocks of the systems map. It is composed by elements, which are the circles, and the arrows, which are the connections between these elements. And these arrows show the causality between the elements. And we have the pluses and minuses. So whenever we see pluses, it means that the two elements are directly correlated, positively correlated. So when one increases, the other one increases. And when one decreases, the other one also decreases. And in the case of the minus signs, this means quite the opposite. When one increases, the other one decreases, because they are negatively correlated and directly correlated. And when one decreases, the other one increases. So for example, here, the more biomedical health intervention we have, the more orientation of biomedical orientation the healthcare system will have. And the more biomedical orientation of the healthcare system, the less health promotion there will be. This is not exactly like this. Sometimes you will see that the narrative of the story is very, very important. The description of the feedback loop is very, very important to understand the system map. That is why we always also strike the importance of having the descriptions of the loops when presenting a systems map, because one can read it differently than the story that the feedback loop in itself is telling. Okay, so now let's dive deep into the systems map, or almost deep into the systems map, because we don't have the time to go through every feedback loop, but I will explain the main structure and the different regions, and going through some feedback loops that I chose to show you. As I told you, the guiding star, which in this case was a society. I mean, we came together with GenCat and we stated this this guiding star, which is a society that conceives of health as a state of physical, mental, and social well-being, intrinsically connected to both the local environment and the health of the planet. And this guiding star then gets translated into this framing question that you're seeing, which is what are the forces that hinder or facilitate a holistic approach to health. And this means one that views health as a state of physical, mental, and social well-being, deeply intertwined with the local environment and planetary health. So now I will go into the map. By the way, we use Kumu, which is the platform that we use for creating this systems map. And we will dive deep into this. But before, I would like to tell you a little bit of the context of this map. This is, of course, the scope of this map is Catalonia. Of course, you will see dynamics that are even global dynamics, or that you can find in other health systems, but that is very important to mention. And this systems map represents a balance between the complexity of the real world system as it is today, and also the need for conceptual clarity and to bring some local initiatives that are already emerging in the Catalan context to highlight their importance of emerging. Because GenCat uses these systems maps to initiate conversations with different stakeholders and co-create these shared agendas that I told you about, and to initiate also projects that contribute to this common vision of what a holistic approach to health is. Again, our role is we're not experts in the system. I've learned everything about health creating this systems map. I have no idea. I don't come from the healthcare or the health field. So we are the facilitators and the creators of the systems map together with GenCat. Does anybody know Carla Oliva? Because she's one of the co-creators of the systems map, and I believe that maybe some there Marta knows her. Okay, yes, she told me to mention her because of course she was a keystone of this systems map, so it's very important to mention Carla in this. You will see Carla's footprint along throughout all the map. And then the broader context of the system map is based on the understanding that many of society's most significant health problem and health issues that we see today are shaped by health determinants and the conditions in which people live. These are the social and environmental determinants of health. And it is estimated that 80% of these determinants lie outside the healthcare system. So saying this, now, yes, I will explain a little bit or describe a little bit better. I will have to move some things around the map. So let's start with the main structure. As I told you before, the main structure is are the dynamics that directly answer the framing question. So these three dynamics together are a summary of the whole systems map, and they answer the framing question. The first dynamic, the first loop, has to do with, it explains how society's narrow and fragmented view of health fosters the development and the dominance of a biomedical approach, which is mainly characterized by reductionist and reactive responses whenever the health issues are already manifested. And this reinforces, that society's partial conception of health. And this dynamic in the left hinders the development of a more holistic approach to health, one that could tackle the environmental and social determinants of health. This is a systems archetype called success to the successful. So in this success to the successful dynamic, the more society reinforces the biomedical approach to health, the more it shapes that collective conception of health, increasing its dominance and leaving the holistic approach to health more under-recognized and under-resourced. This is our main dynamic. And this happens in spite of these two drivers, these external drivers that we see here, that is the emerging evidence of the social and environmental determinants of health and their benefits, and the biopsychosocial model. Although these are very important, the system is still governed by a biomedical approach, approach. The second dynamic of this main structure is also a systems archetype, which is called shifting the burden. And this shifting the burden explains how a problem, in this case, when individuals have health issues, a problem is solved with a symptomatic solution. And this symptomatic solution, which in this case are biomedical intervention, that means hospitalization, medicalization, taking care of acute diseases, etc., diverts the attention from the more fundamental solutions, which is the assessment and the interventions that tackle the social and environmental determinants of health. So the problems are solved You can see this positive sign here, but this diverts the focus to a more fundamental solution. And the third dynamic of this main structure is also a systems archetype, and this is totally a coincidence. We don't always have systems archetypes in the main structures, which is called fixes that fail. So in a fixes that fail, a problem symptom, again, health issues, are tackled by a symptomatic solution, but this has unintended consequences. In this case, the biomedical intervention decreases or diverts the focus of individual responsibility for one's well-being. So the biomedical model's dominance affects how self-care is perceived by individuals. And by presenting health as a matter of medical intervention, something external to individuals, it weakens the sense of individual responsibility for holistic well-being. This is why it is called shifting the burden. So this is our main structure. Any questions so far? Does anyone want to comment on something? Everything's clear? Great. Okay, so then we go into the healthcare system region. From this main structure, we have 5 different regions that emerge, and that we're going to see a little bit in detail, not so much, not going loop by loop, but never mind, you will get the idea. This healthcare system region explores how Catalonia's healthcare system is predominantly shaped by a biomedical approach, although it also faces some limitations and yes, some limitations. So for example, loop 4 explains the obvious, right? The biomedical interventions have a history of contributing to improving the quality and life expectancy, the quality of life and life expectancy. No one can deny that the advances in disease treatment, prevention through vaccination and early detection programs have reinforced this perceived legitimacy. This increases the perception of society that the biomedical approach is trustworthy. So this explains basically the strength of the biomedical approach. Then loop 7, for example, tells us the story of how these biomedical interventions that reinforce a biomedical orientation of the healthcare system tends to focus its resources on treating diseases that have already manifested, while allocating fewer resources to health promotion. And this lack of focus on the health promotion perpetuates the health issues, so reinforces the need for biomedical intervention. And just to show you how this works in the real system, in 2022, the Spanish public health expenditure for hospitals and specialized services, that means biomedical interventions, took the 61% of Spain's public health expenditure. So 61% of a public health expenditure went to the biomedical intervention, leaving much, much fewer resources for health promotion. Loop 8 tells us the story of how this biomedical orientation tends to promote the use of medication as the primary solution for health issues, for a wide range of health issues. And this, of course, is reinforced by the influence of pharmaceutical companies. And this high consumption of medicine could also create long-term or longer-term health issues, perpetuating the need for biomedical interventions. Then loop 10, I will show you now. This is a very interesting dynamic. This is the loop that I told you that we built after we talked with a psychiatrist in Catalonia, that he explained to us that these biomedical interventions, this biomedical approach often treats emotional experiences, normal emotional experiences, like they were medical problems. And this leads people to think they always need professional help to feel better instead of developing the ability to face life's challenges. And this frequently also generates the consumption of medicine. So it is what we call the pathologization of emotional well-being that hinders that individual responsibility that we've seen at the beginning. This was very, very interesting. Then loop 11 is the first relationship between the human health and the health of the planet, right? So the biomedical orientation of the healthcare system carries a large environmental footprint because it consumes a lot of energy and resources. So the healthcare system has a very large environmental footprint. And actually, if the healthcare system was a country, it would be the 5th largest emitter of greenhouse gases. So, of course, this environmental footprint has to do, it increases the degradation of ecosystems, and this impacts in one way or another, directly or indirectly, human health, perpetuating, paradoxically, the need for biomedical interventions. So this is, but fortunately, we have some mitigation strategies happening in the field. For example, the Molet University Hospital has committed to becoming the first net zero facility. And it also was internationally awarded because of this strategy. So there are some strategies in the field that are starting to decrease the environmental footprint of the healthcare system. So this is, broadly speaking, the healthcare system region. Any questions so far or comments? Yes.
Yes, there are 2 questions, Paz, that came up in the chat. So there was the first one from ST, who just noted that you're not labeling your loops. And so any particular reason, and ST, I don't know if you want to jump in and maybe just ask your question to Paz.
Hi, hello. Sorry, I'm running around listening. Yeah, that's my question. I was just wondering what her response was, what the reason was.
Well, sorry, but I'm not highlighting my loops. You mean you're not seeing?
I think you are noting the connections if they're plus or negative, but the loop itself, if it's like I don't know if that's your question, is like showing what kind of loop it is. Is that it?
Or reinforcing? Yeah.
Okay. Yes. Sorry. That's a good view. Yes. I think that maybe in the narrative I say reinforcing or not, but yes, I can go quickly. Well, the archetypes are kind of tricky because they both have balancing and reinforcing feedback loops. But in this case, the systems archetype is saying that this dynamic on the left reinforces the biomedical approach and declines the development of a more holistic approach to health. In the second loop,
okay, I understand. Thank you. I understand the dynamics of loops. I'm just curious why you don't add, your plus or minus or like an label for R or label for B. I mean, it's just another way to label loops. Some people have very much different methods. To be honest, I don't use it often because stakeholders don't really know, the dynamics of what an R is or a B or a plus or a minus. So it sometimes takes away some of it. It makes it too cluttered sometimes.
Yes. Okay. Yes. Now I understand your question better. Yes, we don't use that system because, as you said, sometimes stakeholders don't really understand it. And what we are really wanting to represent here are the narratives, the stories behind the loops. So the dynamics behind the system's behaviors. And sometimes categorizing the loops as balancing or reinforcing is not that useful as the narrative behind that reinforcing or balancing feedback loop. Is that clear?
Okay. Yes, that is. Thank you.
No.
And then Paz, there's another question from Miriam who's asking are you considering here primary care as well as hospital-based? So is it somewhere in this diagram?
Sorry, if we are considering, sorry?
Primary care as well as hospital-based care.
Well, yes, but it's mostly, what a great question. It's mostly, the primary care is mostly taken care in the next region. Well, yes, in the next region. But in this case, I mean, the high allocation to hospitalization is mainly to treat acute diseases and specialized services more than primary care. Actually, in that 60%, Miriam, maybe you know this better than I, but in that 60% of the public health expenditure is not, the primary care is not considered there. I should check, but I'm almost sure that it's not considered in that 60%. So it will be outside this, yes, biomedical approach.
I'm not 100% sure about if the 60% includes or not primary care, but primary care is key for the prevention and promotion of healthcare, and that's why my question. And I have a second question. Do you know if GenCat is going to use these to implement some changes also at the university level on the medical degree?
That's a great question. I have no idea, but here's the loop that kind of explains that dynamic in university education. I'm not sure. I guess that having this loop in the map that states how the biomedical orientation creates more professionals oriented to that biomedical approach, I think maybe it's intended to be here to generate these conversations with universities. And actually, you reminded me that the psychiatrist that told us about this loop, he's also a professor, and I think he teaches in, I don't remember the university, but he's kind of advocating for a more holistic approach to health. I don't know what GenCat's role will be there, but I know they are trying to generate these conversations. Yeah.
Kim also had a question about whether or not the food industry was included here as a key driver sometimes, which yes, okay.
It is. Now you will see it. Yes, I love these questions. And I love that the map is actually representing all of these doubts and concerns. Yes. Any more questions?
I think the last one, but I recall maybe seeing it. It was just, what about preventative health intervention?
Well, we have, you mean the like we have here health promotion and why don't we have an element of prevention? Is that your question?
I wonder, Ron, yes, go ahead.
Yeah, I will dive into this. So I've been experiencing different health systems living in the Netherlands and the US. In the US, preventative health was a big thing. So yeah, let's say doing some tests and yeah, let's say promoting the well-being and things like that was part of the health approach. I'm looking at the systems map as the current state, so I'm kind of meaning you're looking for interventions, and maybe preventative health is one of those interventions, right?
Yes, I think we have, depending on the focus of the preventive care, we have some of those interventions right here in the biomedical orientation, because as we said with the legitimacy, the vaccination, for example, is part of this biomedical approach. But we also have, and it's the region that I'm going to explain now, the orientation or emerging initiatives of the orientation of the healthcare system towards community health, and there are a lot of preventive interventions in there. So it's kind of, today in Catalonia, they are mostly disregarded, but there are a lot of professionals, a lot of doctors and nurses and healthcare professionals that are advocating for this, and a lot of emerging initiatives to give preventative care a bigger representation in the healthcare system. I don't know if I answered your question completely, but it's kind of mixed in the different regions.
Ron, note that it's clear in the chat.
Okay, great. Okay, so then we go into the community health region. This region highlights that today the healthcare systems in Catalonia is limited to mostly biomedical approach, and this limited focus on more community-based approaches that address social and environmental determinants of health reinforce the biomedical approach. And we can see this, for example, in the loop 14, that it's called limited opportunities. So the lack of, or the limited orientation of the healthcare system towards community health leads to few initiatives that address community health initiatives, which could address or tackle the environmental and social determinants of health. And this reinforces the orientation, the biomedical approach of the healthcare system, because there's a lack of legitimacy of community health. So this approach, because it doesn't get developed, it doesn't get evidence that it works, that it has positive impacts on health. So that's why the biomedical approach is reinforced. Loop 16, these are very big loops, is a positive trend or emerging trend that we are seeing in the Catalan system, that there are many professionals in the healthcare system as it is today in the biomedical approach, formed by biomedical approach, that are starting to prescribe the salutogenic assets. These assets, basically doctors are starting to prescribe their patients going to green spaces, to cultural initiatives, to community support networks, to promote health as a way to prevent health issues. So these initiatives are not only enhancing and addressing those determinants, social and environmental determinants of health, but they're also hindering and decreasing biomedical interventions. So decreasing the high consumption of medicine, for example. So we see these trends in the Catalan system, the social prescribing. And then loop 17 is an important dimension, that when the orientation of the healthcare system is towards community health, it decreases the environmental footprint. Why? Because it uses less resources and less energy, because it has a more promoting health focus rather than treating the diseases. So these environmental footprint mitigation strategies that are starting to emerge. One of them is orienting the healthcare system towards a community health approach. So I summarize this region into these few loops. Any questions about this region in particular? So this, just for you to understand, is within the healthcare system as it is in Catalonia, what more holistic approaches to health are emerging. That's this region, what this region is about. Any questions?
So this is basically alternative health approaches, if I'm understanding it correct?
Not alternative in the sense of gurus or those sorts of things. It's all within the healthcare system, like doctors prescribing these salutogenic assets or giving more focus to preventing diseases, especially the enhancing the community networks or having let me see if we have some example here. Well, not here, but there are a lot of doctors starting to prescribe their patients, like, okay, you go take a walk. Instead of prescribing medicine, I prescribe you going to natural spaces, to cultural initiatives, start, I don't know, drama lessons, for example, or supporting each other in a social network. And these prevent diseases because they are tackling that 80% of the determinants that lie outside the healthcare system.
So in the Netherlands, the Netherlands, let's say, alternative health approaches are, let's say, kind of classified, not always, let's say, described by the doctors, and let's say paid by the insurance companies. So, but I think it's more a definition question, right?
It's probably a concept that, depending on the country, maybe it changes. In Catalonia, in Spanish, is salud comunitaria. So that's the concept, having a more community approach to health, basically. Great. If there are no more questions, I will continue with the planetary health.
Yes. Just one more question. Are you considering other, what kind of healthcare professionals are you considering here? Only physicians and nurses, or also nutritionists, physiotherapists, everything?
Yes, everything, yes.
Okay.
Paz, just one quick question. I thought, when you talked about the system archetypes, I thought it was brilliant. Really, you could really tell how the system was working in different ways. And I was wondering, was it helpful to identify and look at them in those different ways? Does it come up with different types of solutions by looking at these different archetypes?
I think the second part of your question should be answered by someone in GenCat. For me, as a systems map builder, it was literally a moment of epiphany that we had together with one colleague, like, okay, this is what's happening. This is the systems archetype that is happening in this system. And that brought a lot of clarity into the system. Like, because this is happening, this is not happening. And it's although there can be a more holistic approach to health, it can really be developed because the biomedical approach has a predominance in the system. And that, for us as systems practitioners, was very, very enlightening. And I think that for GenCat too. I don't know this, like, from now onwards, because we just finished this map, from now onwards, how that will bring different interventions in the system. I hope it works. Yes, Christine.
I had a quick question just on the process, and I mean, it's interesting how you described just now the discovery and how you have your light bulb moments. But when you start a project like this, and my question is around scoping, how do you have this initial conversation with the client, especially if you have to discuss budget and timelines and all of this, if it's tied into a larger project, maybe? How do you scope for something like this if there's so much discovery just imminent to the process?
Well, I think you just like hit the most challenging part of our work. In this case, it was a longer term process, so it wasn't that difficult. And clients usually have their boundaries and their scope quite clear. I don't know if I have a particular answer to your question. I'm trying to think about it, but
is the answer you make it work within the time that you're given? Is that
kind of
as a consultant?
I think so. Yes.
Okay, thank you.
Yes, sorry. Yes, Kim.
Yeah, thanks for this presentation. It's really interesting to sort of dig deeper into all the nitty-gritty of this thing. But you mentioned there are interventions, and I think this is an important point because you do the mapping, right? So you create, so you created this awareness and understanding of the different connections and the drivers, etc. But then, I mean, what's going to happen later, right? The intervention framework, because this is where I feel there's a sort of like a gap, right? Because I think the systems mapping and understand the complexity, the framework used there should be aligned with the intervention framework, right? Because there's not, what do you do with all this information, right? Because you can do whatever with it. You can look at it in a biased way, and then you can just use it in your own sort of, with your own agenda. So I think that's really something that we really need to sort of get better at, really, as a systems mapper, as a systems thinking field. Like, okay, how are we going to use this information? And also aligning our methods with how it's going to be intervened, because I think there's something missing there. But yeah, I would love to hear your comments there.
Yeah, well, it actually depends on the client and the purpose of the process itself. In this case, we are not involved in the intervention part. For GenCat, we build the systems map, and they afterwards they use this to create these share agendas. And if you Google the GenCat share agendas, they show the different systems map that they use to create this common vision with different stakeholders. And they use the systems map in different workshops with different stakeholders. They bring them together and they discuss the different dynamics and how they can work to create systems change. We are not part of that part of the process with GenCat. But for example, with our systemic investor clients, we create the systems map, and we are also involved in identifying leverage opportunities for systemic investing. Of course, the final decision on what and where to invest is our clients, but we use the systems map as the input to decide, okay, if you will invest here, here, and here at the same time, you create systems change. That's our work. So I think that's a step more into the intervention part. But yes, it's mostly depends on the client, of course. And I think you bring up a very good question and a personal concern also.
I see Paz that has a question. Ben, I see there's about 10 minutes left to the time that we have with folks, so you might just want to manage how we want to end, but there's a lot of engagement and interest for sure on the topic so far.
No, maybe I can go quickly. I don't know, Sajies, if you have another question, a quick question, and then I can briefly describe the following regions, and if you want to, in the last minutes, we can, I don't know.
Sure. When you said earlier that you kind of finished the project with GenCat because they want to go away and then do their own sharing, so if they can share their common agendas with others, do you find that there is demand for people actually taking the next step and turning their systems map into or connecting it to, let's say, a stakeholder map to try to understand not only who's driving this system of behavior, to understand who's driving on the system of behavior, and to understand ways to change the behavior of these people so that they can change the system. So that next step, that can be an intervention.
I think it also depends on the client. In the case of GenCat, they already kind of know the stakeholders they're very locally based. The people that we interview are people that are already developing this and taking into practice these emerging trends and initiatives. And that's why GenCat also wants them to appear in the systems map. I'm not sure. For other type of purposes, I wouldn't know. But I think that generally they also kind of know the field. But yeah, it can change. I'm not sure.
Thank you.
Esther, if you have a quick question, you can.
Okay, thank you. Just a quick one. So mine's very much also in just like the process that you carried out this mapping, the process by which you helped carried out the process. So did you actually hold the discussions and then do the modeling, not the modeling, the mapping, or did they also map along with you? Is it kind of like a Miro situation where everyone's mapping and then it creates this big spaghetti diagram and then you have to go afterwards and neaten it up so that it makes sense? And then you go back to them and then you say, this is the neater version. Do you all agree with the structure? Or how did you do it?
Yeah, great question. With the core team, we met bi-weekly. We met every 2 weeks. And usually we advanced on some loops according to what they tell us, the interviews or from the reports. We created feedback loops, and on those core team meetings, we discussed them. Like, do you think this is happening? This tries to represent this and this dynamic, etc., etc. In this particular project, there has been times that we literally built feedback loops together because they were like, no, this doesn't represent. Okay, let's work it together. With GenCat, this co-creation is really, really, we work closely with them. So yes, in this particular systems map, I mean, we handle and manage the Kumu platform, but like we share screen and we say, okay, how can we build this dynamic? How can we name the elements? How can we name the feedback loop? With other clients, now we create everything, and yes, we have the feedback on if the feedback loops are really showing the dynamics that they want to be represented. But yes, okay, so maybe I can quickly go through these 3 last regions. This one is about planetary health. So this region introduces this concept, emphasizing, of course, the deep interconnection between human health and the health of natural systems. So for example, look number 19. No, I will show you, sorry, I will show you number 18 because it's the one about food systems. So the conventional food production practices, of course, bring unintentional or sometimes intentional consequences into the like environmental degradation, water and air pollution, etc. And this, of course, affects also human health. But fortunately, some awareness have been growing within society that there's a link, very entrenched link between the health of the planet and people, and this creates mobilization of society, pressuring the politicians to transform the systems into more healthier and sustainable food production models. And this is starting to happen. This is, of course, this has not been changed at all, but and feedback loop number 19 states a similar one about the pollution from industry, transport, and energy production. Then this region is about the social and environmental determinants of health, and it basically describes how these 80% of determinants lie outside the healthcare system and how they are usually and often disregarded. For example, number 20, we see that our contemporary lives, dominated by the fast-paced work, stress, family and social pressures, etc., limits our time and energy and capacity to self-care, no? And the resulting lack of this space for personal well-being can lead to stress that and hinder our health. And this, of course, decreases our productivity, increases our stress, and of course, we don't take care of ourselves. And then, for example, loop number 24 describes how the health promoting role of nature is often underappreciated, as well as urban planning or the working conditions or the living conditions also. And this narrow view of nature's role in people's health often leads to missed opportunities for prevention and reinforces the dependence on biomedical interventions. That's what this region explains. And last but not least, the community action region basically describes the fundamental pillar that community action is for addressing health challenges. And it explores the role of different stakeholders and actors in society, such as education, culture, the working conditions, into creating or promoting health. For example, loop number 25 states that there's a lack of strategic coordination because there's a lack of the recognition of the role in health by different sectors. Why? Because all the society as a whole, we have this partial conception of health. So if I'm working at, I don't know, in education, maybe I don't recognize the role that education has in health issues, in promoting health, or natural parks, or cultural initiatives. And this regards the design and implementation of collaborative strategies to address health as a whole. There's an exception, which is the shared agenda of the Valles and the Manresa region, which are beautiful initiatives in Catalonia happening that are addressing in a collaborative resource optimized strategy focusing on community well-being. But these initiatives don't abound. And then, for example, loop number 28 strikes the importance of community support. When there's a sense of community, there's a support from the community environment that tackle the social and environmental determinants of health, increasing human health. These appear to be very important when addressing poverty, isolation, access to services, the importance of social networks and community support in these type of situations, and how this could create well-being if it's more developed. So these are the regions, and this is the whole map. I don't know if you have.
Amazing, Paz. I think there was a lot of information here, and I see we only have 2 minutes. I feel like this could have been a half day, even more.
So sorry.
What I would like to know is for folks, so we have an events page. I just put the link in the chat, and then I'm wondering if folks could potentially just go onto that page and add comments about what they felt about this session and maybe proposing some next steps. And we could see what the SI Healthcare Hub could maybe organize to continue the conversation on this, because I see lots of interest and engagement and people are curious. So it's possibly a conversation that we could continue.
I think that's great.
Wonderful. So we'll keep you in touch, but I invite folks to click on the link in the chat, put some comments and ideas, and we'll follow up with participants. But definitely lots of interest. And although this was specific to a region in the world, I think a lot of things resonate with other parts of the world as well. And there might be some nuances or tweaks, but this is great work, Paz. And I know from my experience, when you do system mapping, like, the map is a reflection of what is collectively in people's minds about the system. And then that awareness is what's needed to help create the shift. So hopefully we can all continue the conversation to see how we can bring this to our respective areas and communities. But thank you again for your time. And I'm seeing a lot of kudos in the chat for the work in your presentation. So we'll follow up for sure. This will be recorded, and the SI Healthcare Hub, we have a YouTube channel that all the recordings of past session are there. So you'll see that up there shortly.
Thank you, everyone, for your time, and thank you for inviting me. I hope it was clear enough.
Absolutely. Thank you, Paz.
Bye.
Take care, everyone.
Very good.
Bye,
Thank you.
everyone. Thank you.